Columbia Morning on KFRU. I welcome into the studio Dr. Mark Gilbert. He is from MU Healthcare, and he is a laryngologist. I think I got that close, didn't I, Doctor?
You nailed it.
And there are not many of those in the state, I've learned. So you're
There are
one of the
not
few.
many. There are not many. I mean, there's a few in St. Louis, friends of mine. And then basically for the rest of Missouri itself, I'm it.
So what does a laryngologist do?
Basically, we manage the throat, so larynx, which is the structure of the vocal cords and kind of what's around them. But they're not really cords at all. They're just folds of tissue. But we manage voice, airway, and swallowing problems as our primary focus.
So what do you see most of when people come to you for treatment? And is it hoarseness? Is it vocal strain? What do you see?
There's probably two that I see the most of. One is some sort of feeling of something in their throat, and that a lot of ENT doctors or otolaryngologists see. We call that globus sensation, and it's a feeling of something there when there's nothing actually there. And then as far as the voice stuff, what I see the most of is hoarseness, which is kind of a subjective complaint of either a change in the quality of your voice, difficulty in getting the voice out, or maybe pain when you use your voice. And so hoarseness, which is not really a term we use in medicine because it doesn't mean anything to us, is probably the most common reason people see me for their voice.
What is the biggest reason that people have with their voice? Overuse, or maybe there's some other sickness that impacts that, or it could be directly something that was happening with those folds?
Well, the most common reason a person would have a change in their voice, probably all things considered, is an acute infection. So when they would get an infection maybe of their throat or their sinuses or their nasal passages, a rhinitis, a cold basically, and then they get drainage that lands on the vocal folds, and that causes a laryngitis, an inflammation of the larynx. However, for a long-term thing, for something that's been going on for a while, the most common cause is something called muscle tension dysphonia, which is basically misuse of the voice in that a person is using it less efficiently than they should, and due to that, the quality or the effort required to get the voice out changes.
I can feel that some days. Is it normal? And I'm not talking just for myself. I'm talking for anybody who might be listening right now. Some days it seems harder than others. Just a stress there.
Yeah, it can be, certainly. Certainly if you are working too hard to use your voice, certainly because maybe you're tired from working, if you have to cover a lot of sessions of the radio or even you have to go do public speaking or something, you may get tired from that. And then the muscles in your body try to help out to make it easier to work, but in fact that ends up being almost like tennis elbow or something, where you're working too hard to do simple things, and then it becomes harder, and it's like a vicious cycle.
Do you do surgeries?
I certainly do.
So what kind of surgeries do you do on a throat?
There are several. We do surgeries where we actually make incisions, so that we call that open surgery, where I actually approach the voice box from the outside, from the neck. And most of those have to do with trying to fix a vocal fold that is paralyzed, and I'm trying to push it back. I can't make it move again, but I can push it back into a proper position so that its partner has something to touch. The other surgeries I do are mostly endoscopic, which means I go through the mouth and get to the vocal folds that way.
How much do you have to understand about the nose in order to understand the throat? Because as something you said a moment ago, we have drainage, for example.
Sure.
I think there's things that come down. It feels like it settles right here, right above that, right below, I guess, my Adam's apple, or right in that little indention right underneath the Adam's apple. But I would say maybe that is just drainage. And you mentioned that, so it seems to me like you'd have to understand that in addition to the throat.
I mean, so I'm a board certified otolaryngologist, so I'm, trained in all aspects of ear, nose, and throat surgery, that sort of stuff. So certainly that can play a role. But I don't always look for that as a first source. Sometimes I may do an examination of the nose to look and see why a person's having a voice problem.
All right. Do you give tips to people? In other words, somebody comes to you and you say, well, you're not going to need surgery. This is something that maybe you could help yourself if you just thought of this when you were speaking, or especially at this time of the year. You know this because you just mentioned off the air. I asked you, I saw someplace, I got information that you were a singer. So you sing.
Sure.
Many people are going to be singing in special cantatas or other presentations during the holidays. So what 2 or 3 things would you tell people to respect your voice, treat your voice nicely?
So I actually brought some handouts from you.
Oh,
which
good.
Are
I love
practice
that.
guidelines from the Academy of Otolaryngology Head and Neck Surgery. But and they encompass a lot of things. I mean, see chronic things. Avoid smoking. Okay, smoking is bad for your vocal folds. Everybody knows that. It causes cancer of the throat.
Let me say one thing before you go on further than that. I would agree with you.
Yeah.
I don't like smoking. I've never smoked, never endorsed smoking. People know that I don't like it. My dad passed away from smoking. One of the jokes about radio announcers, though, is that you smoke because it gives you great, as some people like to say, pipes.
Right. Well, and there's a long explanation I can give you later off the air to explain why that happens. There's a pathologic change that happens in some people that causes that. But basically, avoiding things that irritate the throat. So smoking is one of them. Excessive dryness is one of them. Certainly, some medications which dry you out can cause you to have problems. And then you have to rehydrate.
Yep.
Alcohol that's too much. Caffeine that's too much. Even milk and dairy products can actually cause too much thickening of mucus. And thick mucus is bad for your voice box. Think of it like a car. You would not run a car on old oil. Okay. Thick mucus is like old oil. So the things you want to do to make sure that the throat, all of it really, including the vocal folds, are running properly, primarily consists of hydration. Okay. Hydrating. Avoiding,
Water the best for that?
Water is the best. And then avoiding things that dehydrate. And finally, if you're having voice struggles, don't try to overdo it. Don't try to push past. If you have a voice problem more than 4 weeks, no matter who you are, you should see an ENT doctor.
And a voice trouble would mean feeling like you're making sound, I guess.
Change in your voice, the change in the quality of your voice, a change in the effort that's required. Okay, but more than 4 weeks indicates something that could be more sinister, and you should see an ear, nose, and throat doctor.
As a throat doctor, do you advise room temperature water, warm water, or ice water?
I'm not sure it matters. By the time it gets down to your stomach, it's probably all body temperature.
I got to tell you, sometimes I like ice water a lot, and I'll tell you when I'm trying to do something like a production or something like that in the production room, and I've drank ice water, it takes a while for my mouth to warm up. But you're right, the throat part, it's going to be warm by the time it gets down there anyway. What is it that causes people kind of to choke? Like if I'm dozing off, people start to doze off. I'm not talking about maybe necessarily lying in bed, but just kind of sitting there, or just sometimes all of a sudden it's just this instantaneous, like, just choke. I don't mean a cough, but really a feel like a choking thing. Is that?
There's probably a lot of different causes. I mean, sometimes it can be water that goes down the wrong pipe. Sometimes it can be just kind of a spasm in your throat.
Wrong.
Yeah, swallowing wrong, a spasm in your throat. Sometimes if you're falling asleep, it can be sleep apnea. And so, it's probably a variety of causes depending upon the scenario.
What is natural about an aging voice?
So the voice changes quite a bit as you get older. Certainly you get weaker. The muscles atrophy. We call that vocal fold atrophy. And there's a term for a voice as you get older called presbyphonia even, which basically refers to all the changes. The throat changes physiology and structure. The vocal fold structure itself changes where it becomes a bit thinner. So, for example, look at Tony Bennett. Tony Bennett can afford all the voice surgery in the world, right? No matter what, he doesn't sound the same now as he did when he was 25. Okay, but he sounds great. So the point of that is that you can be older and you can learn to use your voice efficiently and you can still perform really well. But you have to sort of accept some of the changes that come with aging.
Like we do in anything. I mean, physically, you don't lift as much, you don't run as fast, you don't.
Right.
Anything else you want to leave us with? I found this very entertaining and
the biggest thing I would say is, if you are a voice professional, okay, singer, teacher, public speaker, yourself, even if you're a barista at your local coffee shop, okay, and you have to use your voice for a living and you're struggling, then you should see at least an ENT, if not a voice doctor, for assistance because they may not understand your needs if you're being seen in a primary care. If you have a voice problem more than 4 weeks, period, no matter who you are, you should see an ENT doctor to get evaluated to make sure something more sinister is not going on.
More problems in the wintertime when it's extremely cold, or does it matter?
Well, it's dry.
Yeah,
that's the biggest thing. It's dry, and then people tend to get a lot of infections that cause drainage, and allergies are not as big a deal this time of year, but certainly the infections, the drainage, the laryngitis, that tends to go up.
Very informative. Thank you so much for being here today.
No problem.
Dr. Mark Gilbert from MU Healthcare. He is one of the few laryngologists in this state. He's been our guest. This is KFRU.